Sanibonani nonke makhaya imina ntombi yenu Thembisile bakwaMahoya, and today I'm here with we are candidate legal practitioners from the Unisa Law Clinic.
We are at the Union Buildings in Pretoria. The President is signing a bill today, making it legislation basically. So the bill is the National Health Insurance Bill. Go check it out if you don't know what that is. But basically we're just finding out the views of citizens, young people mostly, what their views are, if they agree, if they don't.
And Pazul la Union Buildings, trying to find out what are the people saying about the bill that my colleague has just spoken about.
So watch the video.
We're still here to find out about that NHR bill. What do the community members say? Abud, please introduce yourself and tell us what you think of the bill that the president is signing.
Alright, my name is Cyril. I'm a South African citizen, and I'm in support of the bill, basically because health is not a privilege. Health is a right, and I believe that we all should be treated the same when it comes to health, because one of the things is that our health is our wealth. So for our community to be able to be productive, they need to be in a healthy state, be it physically, be it mentally, also financially. And what I like about the bill is that my understanding of it is that we have no upper class or middle class or lower class when it comes to the bill. What will happen, from my understanding as speaking the correction, is that what we are currently paying for those of us that are paying medical aid, that money will be put into a pool which will service everybody the same. As to whether you'll be able to walk from Kokasi and go into a private hospital, that's something that still needs to be discussed. I'm not sure how that's going to happen, yes. But like I said, if the president, if a doctor, if a nurse, if an academic goes and be seen at the same place, we are bound to see our facilities improve, because they are no longer going to be serving the marginalized, which are a majority, by the way. And for that reason, I am in support.
I love that what you said. Let's speak about the access, because that's what most people are now complaining about, to say we don't have access to quality medical health, and therefore it is not as maybe purported by our constitution to be free and fair and equal. And you speak about that, so maybe can you please expand a bit further on everyone getting access to the same quality of healthcare in South Africa?
Okay. Most people are not aware that clinicians, I mean both doctors, nurses, physiotherapists and whatnot, those are the ones that are practicing currently at private. They are also the ones that are practicing in public. So you have the same people heading two heads, but because of their private, they are extorting a lot of money. It's easy for them to spend a lot of time there. So the quality that they are giving at private, which they use as their side hustle, could be used in public, where it will now become an actual job and private will be a side hustle. If roles could be reversed, definitely we have quality, we have qualified nurses, we have qualified doctors, we have qualified clinicians all around in terms of our health. And also, what this will then do is that it will force our government to make sure that we have enough facilities, because health, for us not to have so many ailments and so many mortalities, we need to be preventative. And prevention or in health starts at primary level. So right now, as things stand, we do not have primary clinics that are enough for us to be able to see those preventative measures. Also to have enough resources, I mean facilities, staff, as well as machinery that is used at primary level. If we can prevent diseases and illnesses, we won't have our tertiary institutions overburdened as it stands. And also another thing is we cannot shy away from the fact that, according to stats, we are over, I think, 62 million in terms of our population, but reality dictates otherwise. Those of us on the ground, we know for a fact that 62 years is in paper, but you can ask any nurse who works at a public hospital or any doctor who works at a public hospital if they have seen 20 patients, 8 of those patients are undocumented foreign nationals. And then 3 of those are the ones that are documented, meaning you are only left with 7 of the 20 that were actually budgeted for. But now the amount that was supposed to service people that, according to Stats SA, are there, it ends up servicing more people.
You know, you speak about, and I know we have a very short time with you, but you speak about foreign nationals that are not legal, that are not in the system, being able to access healthcare, right? And this bill also speaks of legal foreign nationals being able to be or being included in this bill. So now, what do you then say? Because now you've just said that 7, I mean, that's a very large number, right? 7 of those people are undocumented but still receive. So how do you think that this bill will now address that? Because who pays for these things? Do you understand? For access. So what do you think of the high people that now come in and access those resources?
Yeah, I've always said this, that for the NHI bill to be able to be properly implemented, it cannot be done in isolation by the Department of Health. We need other departments. We need the DID, Department of Infrastructure Development, to be able to have more facilities. We need the Home Affairs to be able to make sure that people that are in the country are well documented and are known. We also need to have the SAPS involved as well as the SAMDF, because now we have porous borders that allow each and everybody. We don't mind having foreigners. We've always had foreigners outside, coming from outside the country, but we've always known that 2 people are coming into the country, and we know where these people are. And when we budget for health, we also take them into account. But now, if we have 2 people that we know, but there's actually 30 more people that we do not know, it makes it very difficult for our budget to be able to sustain that.
Indeed. Thank you very much, sir. That was very insightful.
Thank you.
Sabon.
Bongamen.
You understand, the poor can't put their hands on things what they need.
Yes.
But if you look what government structure, all their things are working too slow for the masses. And another thing, like me, I'm an ex-soldier. I never received a pension fund from the South African government.
Yeah.
And we all are waiting for that time.
So do you think it's a good idea that now people will have access to private hospitals as well, whereas like previously they wouldn't because they can't afford?
Yeah, because you look at our hospitals are falling apart. Our buildings falling apart, like Union Building fall apart.
Yeah.
There's nothing the government is doing right for the people.
Okay, do you think they're passing this law now, or this
You
bill now?
know laws they passed is demonic. I don't believe in demonic laws like the bill. It's demonic. I want a future for my children. I'm an old man, I'll die tomorrow. But what is my child going to eat for the future?
We are here at the Union Buildings to speak about the National Health Insurance Bill signed by the President just today. We are here with members of the community and we want to ask them, what do they think of the bill? Mama, what do you think of the bill?
Okay, my name is Malodi Mukori. Hence, I think the national health, it is very important because most of us have no employment, and being unemployed we cannot go to private hospitals. It is more important that we have all of us need health, because the nation needs very, very healthy nation so that we can move forward with productivity. That's what I can say.
Thank you. And then when I ask, what do you think of the bill?
Then I think it's a good idea. We'll accommodate everybody so that we get, sometimes when you go to the public clinic, you don't get them, your medication doesn't work for you. So for private, you get faster help, faster service and better medication.
So the bill basically will improve service delivery with regards to health in the communities.
Yes,
Okay,
yes.
so
Sometimes we are lazy to go to the clinic because when you go, they give you a line. They must come back tomorrow. Tomorrow again, it's a line. So like that, they will be helping a lot of people who drink our medication.
So the bill will address the ineffectivity of clinics and public health services in South Africa.
Yes,
Thank you very much.
Thank you.
Thank you very much.
I'm here with Tumelo and Gaurelo, so they're obviously ANC members. So we just want to hear what's your view on the NHI bill which the president is passing today?
I'm Vitimelo. For me, I think it's perfect, and then at least some of the things gonna change, and then in a positive way. I'm so proud of everything that our government is doing for now. I'm very proud.
Farelo,
I think it's enough that she has said earlier. It's very good.
do you think, because people are saying that maybe it's a campaign strategy, that the president is passing it now just at the eve of the elections, do you think that's the case?
No, for me, no, it's not.
Phansi phezulu emphakathini ngilana nobhuti Nhlanhla. Please tell us what you think of the bill that is being signed by the president at this present moment.
uRamaphosa lento ayenzile siswami yinhle kakhulu, because makavulela ibhedlela lezi kumele siyobhatala imali eziningi, wabona ama private, yabona makavulela uyenza kahle, because ama line emakliniki angeke sisahlala sibhizi sisondela lesondela, you understand, futhi manje nabantu laba abafayo, so yabona futhi manje sisazophila, because ama ibhedlela lezi government uthola iline abogogo yini uyabona, manje makavulela leyo awa siyamvuka.
So you think that more people will now be impacted with regards to accessing health when now both private and public hospitals work the same way?
Yonke into ihamba ngolayini sisi.
Hamba ngolayini, as
Ihamba
you
ngolayini
said.
sisi.
Hamba ngolayini ke.
Ihamba
Phansi phezulu
ngolayini.
emphakathini.
Hayi, yonke into right.
Ngiyabonga.
Yebo.
Union buildings, Samben.
Yebo.
Union buildings, we are still finding out from the people. What do you think of the bill that is being signed by the president? No.
Okay, like for the health, we would say that private is good, because like immediately when we go to private hospitals, they just help us, like the service is so good. So yeah, that's what I can say for health.
And like line, like
Exactly,
go
yeah.
private kwa hauna line, go tshwana le go public. Go public re
Government.
masibaka.
The
And
service,
nako ngwe ba re cut short, ba re like ba thusa batho ba certain amount, then rena ba re thusi. So private e betere ka re pira ke tsa gape.
so private hospitals are the
Yeah,
best.
it's the best.
So basically this bill is going, you are supporting it, you are agreeing
Yes,
with it.
we
Yeah,
are.
we
We are,
agree.
because like the
It's a
service.
very good.
So you mentioned service delivery as one of the main things. And ke batla go botsa hore service delivery tshwantse e be right even go the public. So now haria go the public is ingekho right. Now we are going to private. You think it's going to change?
I don't know about that, but for now I'll stick with private, because private for now, like, the service is just perfect. Little line service, that's why you're service. I would say that service, and even though the care that they give us there. So
Abantu bayavuma. Samben.
So Tabango, what's your view on the NHI bill that the president is signing today here at the Union buildings?
President this bill, national health insurance. It's a positive thing to accommodate South African citizens, because come on, program that medical health, para medical that there is a rich.
Oh yeah, but then go na le batho ba ba reng no it tlo bedena the private health sector, and then maybe abandon capacity. Do you think that's true, or maybe people just don't want other poor people to access healthcare?
Can need the go disadvantage the private sector health workers.
Yeah.
Because no, they are all like, but almost pay what check out the private hospital, private clinic already now more or what so at least the president has signed this bill. Mara it will affect the taxpayers because illegal or tax increment.
Yeah.
So we complain the taxpayers. So they not this president said I do so.
Yeah.
Because the leader, to be honest, in South Africa, the leader gets taxpayers. To be honest. Another thing, or this bill might lead to corruption.
Okay.
Might lead to corruption. Yes, but what to say about 12 or about one system. Other thing, or the foreigners to advantage.
Sarah, you're from Uganda, right? So what do you think about the national health insurance bill that's been signed by the president today?
What I think, like when we go to hospital, which is public here, as a foreigner, they don't treat us equally, like
Okay, yeah.
and us.
Yeah.
Because they say we are finishing medicine in the hospital. Then we used to go to private hospitals. And there they need too much money.
Yeah.
To see a doctor, they must pay like 700 before they give you medicine. So when you pay that 700, after that, you're going to pay money again for medicine.
Oh, yeah.
So which is late, we can't manage it.
So this will assist you to get like quicker healthcare services.
Yes.
Okay.
Phezulu emphakathini, we have heard what the community are saying about the bill. Haibo, people are informed and they know what they want. This might be access, or might it not be? Saz Sobana Kong.
Okay, we've had the citizens. Let's hear what you have to say. Share, comment, like our pages on all social media pages, LinkedIn, Twitter, TikTok, Facebook, and also YouTube. It's Unisa Law Clinic at all social media pages. Bye.
Signing out. Bye.